Gangrene Part 2. There is something that I forgot to mention to you that should never be forgotten. I remember a long time ago my cousin stepped on a nail and the wound would not bleed. My grandmother took some snuff out of her mouth and packed the wound with the snuff. Those old folks knew something. The spit and the snuff was one of the most powerful antiseptics they could have used. It drew all that metal and all that corrosion out of the wound. Then my grandmother spanked the bottom of my cousin. When I get a gangrene wound ready, I spank it. As I do that, red blood will come up in that old white meat that was not getting any circulation. I keep spanking it until the blood begins to trickle and run. When that happens, the leg will start hurting really bad. But you have won the victory. You have defeated this menace. Because when it bleeds, a scab will develop and it will heal over. If you don't want to spank it, you can give the patient a hot and cold foot bath. That would increase blood flow down to the lower extremities. That also can cause it to bleed. That is another wonderful way to bring that blood into the area so that it will heal properly. If the gangrene is truly severe, you may want to use a small bottle of iodine. Take about 1 ounce of iodine and mix it into a pound of sugar. Apply this on the wound. That will help to accelerate the disinfecting process. Remember, this process could take up to 2 weeks or longer depending on the gangrene. But the main goal is not to get amputations on your feet or your legs. If we can get the gangrene under control, and then, of course, you eat better and you do the 8 laws of health, and then you should never have this problem again.